Today, we're diving into a medication you've probably heard of, Metoprolol. It's one of the most common beta blockers out there for heart conditions. So if you or someone you know takes it, stick around. We're going to break down exactly how it works, why it's used, and some absolutely crucial safety info you need to know.
You know that feeling, right? Your heart just starts hammering in your chest before a big presentation, or maybe when something startles you. That thump, thump, thump is a feeling we all know. And believe it or not, it's the perfect place to start to understand metoprolol.
What you're feeling is your body's fight or flight response kicking into gear. It's this ancient, hardwired survival instinct that gets us ready to handle a threat. Whether that threat is a lion back in the day, or, just a really stressful email in your inbox today. So, what's pulling the levers on this whole response? Well, it's a group of hormones called catecholamines, and the most famous one on that group, of course, is adrenaline. When your body unleashes these, they send a very clear, very loud message straight to your heart, basically shouting, "Let's go, work harder, pump faster, now." Okay, so if you think of adrenaline as the gas pedal for your heart, then metoprolol is kind of like the brake. Let's get into the nitty-gritty of how it actually calms down that overworked heart. To really get this, we have to talk about something called beta receptors. Think of them like little docking stations. Adrenaline needs to plug into these to deliver its message. And there are two main types we care about here. You've got beta-1 receptors, which are mostly found in the heart. Their job is to rev off your heart rate. Then you have beta-2 receptors, which are mostly in your lungs, and their job is to open up your airways to help you breathe easier. Now, here's where the magic of metoprolol comes in. It's what we call cardioselective. That's just a fancy way of saying it's a specialist. It's designed to target and block those beta-1 receptors in the heart way more than the ones in the lungs. It's like having a key that fits the heart's lock perfectly, but doesn't really work on the lungs' lock. And that selectivity is a huge deal, because it lets the drug calm the heart down without messing with your breathing too much. So it sets off this really clear chain reaction. First, metoprolol gets in there and physically blocks those beta-1 docking stations. Adrenaline can't plug in. So what happens next? Well, the heart rate starts to slow down, and each beat is a little less forceful. And the end result of all that? The heart's total workload goes way down. It doesn't need as much oxygen. It basically gets to chill out and take a much-deserved break.
All right, so now that we've got the how, let's talk about the why. Why is this mechanism so useful that doctors prescribe metoprolol for so many different things?
And I mean, this drug is a real workhorse. It's a go-to for high blood pressure. It's used for chest pain or angina because it lowers the heart's need for oxygen. It's absolutely vital during a heart attack and to prevent more from happening. It's also used for certain kinds of irregular heartbeats, and even, get this, off-label to help prevent migraines. It's incredibly versatile. Now, here's something that might make you scratch your head a little. Using a drug that makes the heartbeat less hard to treat a failing heart, that sounds totally backwards, doesn't it? But think about it. In chronic heart failure, the heart is under constant attack from its own adrenaline. Metoprolol acts like a shield, protecting the heart from that relentless wear and tear, which over the long run actually helps it work better. Okay, I need you to lean in for this next part because this might be the single most important practical thing we talk about today. You see, not all metoprolol is created equal, and knowing the difference is absolutely critical. So metoprolol comes in two main flavors, tartrate and succinate. Metoprolol tartrate is the fast one. It's immediate release. It gets to work quickly, and for that reason, you usually have to take it a few times a day. Metoprolol succinate, on the other hand, is the slow and steady one. It's extended release, designed to work over a full 24 hours, so you just take it once a day. And this is the version that's really proven to work well for heart failure. And here is the bottom line, the most important takeaway. You cannot, I repeat, you absolutely cannot just swap one for the other. They are not interchangeable. A 50 milligram dose of the fast-acting kind is a totally different thing than a 50 milligram dose of the long-acting kind. Any change has to be done by a doctor. Okay, let's move on to what everybody needs to know before taking any medication, the potential side effects, and the really big safety warnings. Since metoprolol's whole job is to slow things down, the most common side effects make a ton of sense. Feeling tired, especially when you first start, is super common. You might also feel dizzy, notice your hands and feet are cold, or just have a slower heart rate than usual. It's all about working with your doctor to find that sweet spot where the good outweighs the bad. But out of everything we're going to talk about with safety, there is one rule that is more important than all the others. This is the non-negotiable one.
You should never, ever, ever stop taking Metoprolol suddenly. Seriously, this is so incredibly important. I can't say it enough.
So, why is this such a huge deal? Well, when you're taking metoprolol for a while, your body gets used to it. If you suddenly stop, your heart becomes extra sensitive to adrenaline. It's called a rebound effect, and it can cause your blood pressure and heart rate to shoot up dangerously high, which could even trigger a heart attack. If you need to stop, it has to be done gradually by tapering off under your doctor's watch. And one final, quick but important note. For anyone with diabetes, metoprolol can be a little tricky. One of the key warning signs of low blood sugar is a fast pounding heartbeat. Well, since metoprolol slows your heart down, it can hide that symptom. So if you're diabetic, you just need to be extra careful about checking your blood sugar levels regularly. So, there you have it. Metoprolol is this amazing tool that protects our hearts by basically telling adrenaline to take a step back. We've gone over how it works, what it's for, and the biggest safety rules. The real question now is, what does all this mean for you? Armed with this knowledge, what questions are you going to ask your doctor to take charge of your own health?